you are going to walk away from this talk saying, I can't believe she just covered that much in 50 minutes, which is what I'm going to do. I always want to tell you so much, and like Brenda said, Birdie, you realize how many slides you have? And I'm like, yes, Brenda, and you watch me fly through them. So she believed in me. She didn't really doubt me, but just for a second, right? So I'm also on the Maternal Mortality Review Committee for Indiana, and I know some of you are here too. I work very closely with our IPQuick. You're called TIPQC, we're called IPQuick. I work closely with the Department of Health. This may bring up feelings when 1 in 5 to 7 women and 1 in 10 men have a perinatal mood disorder, or you're close to someone. Then I know many of you in here have been affected by it closely or will be, and so I just like to say, trigger warning. It's the vision of Postpartum Support International that every woman and family worldwide would have access to information, social support, and informed professional care to deal with mental health issues related to childbearing. PSI promotes this through advocacy, collaboration, and by educating and training the professional community and the public. So I was up here yesterday and told you all of our resources, and when I sat down, I thought, I only told you resources for the help seekers. The resources we have for the professionals are even wilder, so that's what I want to tell you, everything. Many of you probably know Jen Hamilton, a nurse that's very famous on social media. Well, her sister had postpartum depression. She has done a podcast with our PSI podcast called I Am One. She and her sister did it. And this week, somebody got a hold of her to say they weren't doing well. Some of you may have seen this on social media. And so she shouted out Postpartum Support International for help, and our calls this week, just in the last few days, have just skyrocketed. We know that if we're not treating perinatal and mood and anxiety disorders, that we're having all kinds of problems, the worst being homicide, suicide, infanticide, and we shouldn't have deaths. And we know that when me on the Maternal Mortality Review Committee I'm preaching to the choir, but number one reason for maternal mortality is substance use disorder and mental health disorders. And I've spent years watching people come back from conferences and give reports on what the number one reason for maternal mortality was years ago, those who were older like me, and all they talked about was the neck down, right? And that's important. But I kept saying, what about this? I'm seeing lots of mental health issues, and I see lots of suicide. And suicide comes from hopelessness. I'm never going to be myself again. Or it comes from psychosis with commands. And so we've got to look at that whole gamut. Also, as part of this entire wonderful conference that TIPQC put on, is that we're having increases in nicotine, alcohol, drug use because of a perinatal mood disorder, many times when they've never even had an issue before because they're self-medicating. So we call it perinatal mood and anxiety disorders, but your people call it, all of our people call it, the world calls it postpartum depression. If I'm looking for help, I'm going to Google postpartum depression. If someone says to me, Birdie, what do you do? I don't say, I work in the field of perinatal mood and anxiety disorders. Because if I do, they say, huh? So I just say I work in the field of postpartum depression. Everybody knows what that is. We also call it perinatal mental health. Again, no one knows that term. What's the prevalence? 80% get the baby blues. 80% of women get the baby blues. Remember that most research has been done on white heterosexual couples until about 10 years ago. But when I say moms, I mean this research was done on moms all around the world. Wherever we do research, 80% of us get the baby blues. That's not a diagnosis. 1 in 5 to 7 women get beyond the blues. And your first teaching point 2 teaching points that you all want to know when you're teaching your clients. This affects 1 in 5 to 7 women, 1 in 10 men. Baby blues only last 2 weeks. If you're beyond 2 weeks and you're not feeling like yourself, something else is going on. People walk around thinking they've got the blues for 18 months. We've got to do a better job of teaching them when they leave the hospital, when they cross your path. 1 to 2 have psychosis. Don't call it rare. 1 to 2 in 1,000 is not rare. It still happens, not as common as 1 in 5 to 7. 1 in 10 men experience postpartum depression, and we're not asking the men and partners at all. When I use the term postpartum depression, it means it only happens in the postpartum period and it's only depression. So what do? We send them home saying, if you find yourself crying a lot, be sure and call your doctor. Well, that's not helpful when I wake up mean as a snake. Okay, screaming at my toddler, screaming at my spouse. When I wake up jumping out of my skin with anxiety, you didn't tell me to watch for that. So we've got to be better with not just telling people it's crying. That's what they think. It's either crying or wanting to kill my baby. They see Andrea Yates drowned her 5 children, and they say to me, Birdie, I don't have the kind of postpartum depression where you want to kill your baby. But let's keep in mind, some women after having a baby don't fall madly in love with their baby. Some dads don't, some partners don't. You don't put that on social media, do you? Hey y'all, you told me I was gonna fall madly and gushy in love with this baby, and well, I don't feel it. I mean, I love her, she's my baby, but I don't feel that feeling you told me. And some of you experience that. It's like they grow on you later, but you don't. You know, especially the screaming ones or the spit up ones that spit all the time. That gets on your last nerve. So we have this thing. Anybody notice that my head's attached to my body? Do you notice this? Why is it okay to treat my high blood pressure? Why is it okay to keep me on my meds during pregnancy? You wouldn't say to me, Birdie, go off your blood pressure medicine. Let's hope you don't have a stroke during pregnancy. Hey, I know you've got diabetes and you're on insulin, but let's get that pancreas to kick in a little better and get you off that insulin. But every single day we have people being taken off their antidepressants because they're saying, we want that baby natural in the womb and I'm not sure it's safe. Come on, guys. We've had over 40 years of research with SSRIs and almost as much research with our antipsychotics and mood stabilizers. We know which ones are safe. We know which ones are not safe, and they're still being ordered. So we've got to stay up. If you don't know, most people are just calling it postpartum, okay? Listen, I hope I don't get postpartum. My sister got postpartum real bad. Okay, you know what I'm saying, okay? And you do it sometimes too. It's okay. I know what you mean. So in our lives, we have seasons of giving and seasons of receiving. And when you're in the postpartum period, you're in the season of receiving. That's a teaching point. It's okay to ask for help. It's not a weakness to ask for help. So when I have a baby, guess what? First baby that you have, and anybody who's pregnant for the first time in here, I'm sorry I'm scaring you, but I'm going to. I teach a 4th trimester class and I try to get them ready, but they still say to me afterwards, why didn't you tell us about this? I did. You can't hear it. When you are pregnant for the first time, you are so delusional about how much your life's about to change. Not a clue, right? If you really knew, would you really do it? I don't know. Because it's really unbelievable. Overnight, you lose all your freedom. You don't get to come and go as you please anymore without a diaper bag, and you don't even have a purse anymore. Everything's in the diaper bag. You don't get to just run down to the store. Yeah, you're taking a baby with you. We teach you how to change a diaper on a plastic doll in childbirth ed class. How could we explain that baby's going to poop all the way up to the back of their neck, right? The second you get them in the car seat, that very second. So overnight, we lose all of our freedom, all control of our schedule. Our schedule's our baby's schedule, and we don't have a clue what we're doing. And everybody's lying on Facebook and social media. They're saying that they love their new life, and this is just wonderful. And they also say things like, happy anniversary to my best friend. What is that about with the best friend thing, okay? Come on. And they hate each other. They're in my family. I know who they are. They're both lying on Facebook. So many of my clients say that they get off social media because it looks like everybody else has it together but them. So we lose money. We don't know what we're doing. Career potential. What is normal? Try to watch the word normal. It's a setting on your dryer. That's it. Okay? How many of you in here are normal or come from a normal family? Raise it high. Come on. If you don't know this already, you have a diagnosis, okay? You did not escape what you inherited from both sides of your family, both medically, high blood pressure, heart disease. You also inherited what you got. My mother's side of the family, oh Lord have mercy. When we get together, I turned to my cousin one year at the family reunion and I just said to her like this, you know ain't none of us right. And she turned to me and she goes, some worse than others, but ain't none of us right. And we just laughed, right? Because there's lots of depression, lots of bipolar. Then I married into a family that my husband's family, lots of OCD, lots of bipolar, substance use disorder, also on my side of the family. Bingo, guess what our two girls got to inherit? All those things. Did they get out of that without getting a diagnosis? No, they did not. They got the best of both worlds. So they knew their diagnosis by junior high, and you should know your own diagnosis, and you should be the best you can be with it and quit pretending you don't have something. Because if we are honest about our own diagnosis and we share that, not overshare, please, with your clients, they're not supposed to comfort you. Get it together, get your own therapist. But if you know your diagnosis and you commonize that, okay, then we all start to commonize the fact that ain't none of us right, okay? And it's okay. So be the best you can be with what you got. Your head is attached to your body. Quit acting like it's not. So here's the meat of what I want to tell you in this short time. And then I'm whetting your appetite to hear more, to come to more trainings that we have, and you realize that you really didn't know what you didn't know. Perinatal mood and anxiety disorders can be depression, anxiety, panic, OCD, PTSD in childbirth, bipolar, and psychosis. And I'm going to hit them so fast your head's going to be spinning, okay? Biggest study to date, the largest study to date, 10,000 women by Catherine Wisner, reproductive psychiatrist, and others, found 10,000 women found what? That almost 22% got a perinatal mood disorder in the 10,000 women they researched. What did they find? Where we get the 1 in 5 to 7 women is 1 in 7 developed it during pregnancy. 1 in 7 came into the pregnancy with their own background. 1 in 7 during pregnancy, 1 in 7 in the first 3 months. But when they carried that research out for 1 year, 1 in 5 developed. So that's where you hear me say 1 in 5 to 7. What did they have? 68% of them had depression. But look what went right along with it. Look who hangs out together, depression and anxiety. Sometimes you'll see the presenting factor is only anxiety with no depression. Sometimes you'll see depression with no anxiety. But if we're constantly talking about depression and crying, we're missing the anxiety. I got a call yesterday from someone from Indianapolis, not knowing what to do with the client, and my name's still out there, even though I'm not seeing clients anymore. She was like, I don't know what to do with her. She hadn't slept in 3 days. Well, we got to take care of that right now. You don't sleep for 3 days, 4 days, you can go into psychosis, even if you don't have a history or an inclination to get psychosis. So 22% of them had bipolar disorder and 19% endorsed thoughts of harming themselves. Again, preaching to the choir, we know the number one reasons for maternal mortality: mental health and substance use. Blues only last 2 weeks. They peak at 3 to 5 days due to the crash in hormones when we deliver a baby. When we're pregnant, estrogen and progesterone way up here. When we deliver, they crash down. Up come oxytocin, prolactin brings in the love hormone, brings in our milk. But it also makes us, whoa, we cry so easily. But it's happy tears. It's overall mood happiness. We kind of adjust into parenthood, and that baby blues phase goes away. After that, if they're not adjusting, and we're all adjusting to new parenthood, but still, this is not a diagnosis. So overall, and I just told you, I'm going to show a really quick, cute video. This is an organization we work with. Okay, depression, just what you know it is: sadness, crying, typically overeating junk food, sugar, and chocolate, typically oversleeping and still feeling horrible and still tired, suicidal thoughts because I'm never going to be myself again. These people literally are not brushing their teeth. They're not taking a shower. They're just dragging from day to day, barely taking care of baby. They don't want to see you because they are faking it so hard and they don't want anyone to know how bad off they are. Irritability and anger and rage could be a part of it, and they think they're the only one. They do feel hopeless, helpless, guilty, and ashamed. Birdie, why am I in your office? I have a healthy baby, a wonderful spouse, and a beautiful home. This is embarrassing. Yeah, you know what? You didn't get this from hormones. You got this because you happen to have a lot of risk factors. Thank your family for that. So I am so overwhelmed. If I'd known it was going to be this hard, I wouldn't have had a baby, or I would have waited 5 years, because you think you're going to be smarter in 5 years and you're not. So you can't take care of yourself. You have anhedonia, loss of joy, pleasure in the usual activities you used to enjoy. They just don't care, like blah, totally. And they're saying things like, they don't wake up and say, I think I have postpartum depression. They wake up and say, this doesn't feel like me. Something's not right. I haven't been myself since a baby was born. But they don't always recognize what it is. So depression, anxiety, can't sit still, agitated, mind going nonstop, worry, calling the peds office, calling the OB office, feel like they're jumping out of their skin. They are not eating. They cannot fall asleep. They can't stay asleep. They can't go back to sleep. We see them at 2 weeks. They've lost 20 pounds, and we say, woo, look at you, got your figure back. No, you see somebody who's lost 20 pounds in 2 weeks, 30 pounds in 3 weeks, they are anxious, they're not sleeping, and they're not eating. And everything is perfect, their baby is perfect, they might even be perfectionists, where now suddenly if you are perfectionist, everything in order, you're a mess now because your life is not in order anymore. They get short of breath, their heart pounds out of their chest, then they could go into a full-blown panic attack. Lips go numb, face go numb, hands go numb. They might get chest pain. They end up in an emergency department thinking they're having a heart attack. And they get told, no, this is postpartum anxiety. They might give them a benzo, but guess what? If you're sending your patients to the emergency department thinking they're going to treat them, they're not. It's not a clinic. It's not an OB office. It is the emergency department. They might give her a benzo, send her home, and what are they going to say? Call your OB in the morning. People send them to emergency department thinking they're going to treat them with an SSRI. No, they're not. They're caretakers. They're not doing it. So you have to help them get resources, which you don't know what they are, and I'm going to tell you what they are. So 3 greatest fears of a panic attack. I was afraid I was dying. Afraid I was losing control. I was afraid that I was going crazy. That's how you'll hear it described. OCD. What do we mean when we say you're so OCD? It means everything's in order, you're real neat, right? But if you really truly have a diagnosis of OCD, it can be very debilitating. typical is this cleaning, checking, counting, ordering, okay? So those of you who have it know, and that is that someone comes in to help you with laundry when you have a brand new baby, and you can barely let them do it because they don't fold the towels right? And you have to go back and do it over. Now see, I like my towels folded a certain way, but I don't have OCD. That's not one of my diagnoses. So if you come in and do my laundry, thank you for doing it. It's fine. I'll worry about how the towels look later, but right now you can do my laundry all you want. When I feel better, I'll fold them right again. But right now I don't care. Someone with OCD, they can't let you help them because you don't do it right. They can't fall asleep, stay asleep. All of this worry is mixed in with it. They're obsessed with germs. During COVID, these people were really a mess. We were all a mess washing our vegetables and fruits, but these people were really even more of a mess. So things have to be in a certain order, numbers, that kind of thing. The other way OCD looks, the most misunderstood diagnosis. I clearly saw my daughter gray and dead under the water. I couldn't give her baths or take her swimming or put her anywhere near a body of water. What kind of mother thinks these things? My daughter would have been better off dead. Intrusive thoughts. They come out of the place in your brain where you want to protect your baby. They're taken and twisted and said, what's the worst that could happen? And then you have an image, a picture, a movie playing of it, and you start seeing vivid images. And if you tell it to the wrong person, you're getting DCS, CPS called on you. You're getting sent to inpatient psych because they think you have psychosis and you have OCD, intrusive thoughts. So let me give you all an intrusive thought. Some of you are saying, oh my gosh, that's what I have. And some of you are saying, I've never heard of this before. So you're driving down the highway and you're behind one of those trucks with the cars chained up on it. What's gonna happen? Every one of those cars is coming off, right? Every one of them. And I've never seen it, but everybody says Final Destination, right? Okay, I've never seen it, but I know it's logs going everywhere. That's another intrusive thought. I know that when I'm on the highway, I had on 465 Indianapolis, a mattress flew out of a pickup truck right in the middle lane. I was in the right lane. I spent 5 minutes ruminating about if I'd been in that middle lane, that would have wrecked my car. God, somebody's gonna have a wreck because of that mattress. I'm so glad I'm in the right lane. Oh, I hope nobody gets hurt over it. I just kept ruminating about it. Think if you have intrusive thoughts, they can't even drive. Like the thought of driving, and now a baby's in the back seat, and tailgaters still gonna be tailgaters. And so many times the anxiety's so bad they can't even drive. Hypervigilance. So here's the most common intrusive thoughts for new moms. I want you all to know them. You ready? I'm gonna give some of you some intrusive thoughts, and I'm really sorry about it. But I'm not really, because you need to know what this is. Water, where you just saw her bathing her baby and she worries about her baby drowning. She might see images of her drowning her baby. I had a woman tell me that in the delivery room with her first delivery, first baby, she had a thought of, what if I throw this baby to the floor right here in the delivery room? And then she said to herself, I can't tell that to anyone. Why did I have what kind of mother am I? That wasn't psychosis. That was an intrusive thought. She's not gonna do it. So water, heights. They get to the top of the stairs in the morning, they're getting ready to bring the baby down, and they suddenly have a thought about falling down the stairs, baby flying out of their arms, maybe even throwing their baby down the stairs. Who are they gonna tell this to? Oh my gosh, why am I having these? Why am I having these? They might have a story playing, a movie playing. Sharp objects, they're in the kitchen, they're cutting a tomato, and the baby's right over here in the little pumpkin seat or car seat, and they think, what if my hand slipped and oh my gosh. They see a vivid picture, vivid. I want you to imagine vivid. And so now, water, heights, sharp object. They take all their knives and scissors, they lock them in a lockbox, they put them in the back of the closet. They sit on their behind and bump down the stairs. They won't give the baby a bath. They won't go over a body of water. Traffic, they won't drive, and some even have sexual thoughts when they're changing the baby's diaper. They're not gonna do those things, but they are so horrified. Last thing you'll hear about, and let's keep in mind, this isn't just the birthing person, this is both people. The mom and the dad or the partner could all be having, both of them having intrusive thoughts. We really got a mess, because they're just a wreck in that house. But Remember, everybody has their own diagnosis, so you never know. So they have guilt and shame. They're not telling them. When they do, they don't get the right treatment. Thoughts do not equal action, okay? They are not going to do those things. We have to ask more questions. If you have questions, you've got somebody right in front of you, and you say, I don't know if it's psychosis or intrusive thoughts. Call the hotline. You got the number now. You got magnets. You can call the hotline that is answered by Postpartum Support International trained therapists, and they will walk through with you, is this psychosis or is this an intrusive thought? It's really very simple, but I make it sound simple. I've seen lots of psychosis and I've seen lots of intrusive thoughts, but I'll do it here in a minute. Thoughts low, parent doesn't want to harm the baby. This is OCD. They're just horrified by the thoughts. The thought is obsessive in nature. They're not seeing things that aren't there. They aren't hearing things that aren't there. They're not delusional. They're in touch with reality. So you cannot say to them, well, does your thought scare you? If they're having psychotic thoughts, they might say back to you, yeah, it does scare me. You have to say then, what is your thought? So what I say when I do an intake is sometimes new parents have scary or unusual thoughts. Are you having any? Oh my gosh, I can't even say them out loud. They're so awful. I can't believe you asked me that. Or they're saying things like, you know what, Birdie, actually I keep worrying, what if my husband dies and I'm left all alone to raise the baby? That's a real scary thought. What if someone breaks in my house and steals my baby? That's a scary thought. What if my baby quits breathing? That's a scary thought. But they're not intrusive thoughts. Intrusive thoughts, they'll go, oh, they're awful. I'm seeing pictures and images. But if they're psychotic, they might say, oh yeah, they scared me. Here's a scary thought that is psychotic. I had a client call me and said, Birdie, last night I was holding the baby and his eyes started glowing. And I said to my husband, take the baby, his eyes are glowing. I think he's demon possessed. That's not an intrusive thought. That's not a what if my baby is demon possessed. That is, she was having delusions and hallucinations, yet it scared her. Psychosis waxes and wanes, and if we miss it, then we have the psychotic break, and that's when we hear Andrea Yates drowned her 5 children. We also many times will hear with a big case that they were just taken off their antipsychotic 2 weeks before that. You'll hear that a lot. So psychotic thoughts, they're having delusional beliefs about the baby. Baby's a demon. Really, they're up on the same level as God and angels. They have special powers. They are grandiosity. You'll hear all kinds of things. I could go on and on. 80% of our primary care physicians, primary care people are misdiagnosing OCD. Okay, I get it. So we have support groups for about everything you can imagine. That's why I want you to go to postpartum.net, the tab Get Help, send your clients there. They will find a group for just about anything that ails them. And we also have peer mentors. We also have a warm line and a hotline. Warm line, they leave a message, somebody gets back with them, reassures them, and hooks them up with resources in their state. So you have people right here in Tennessee who volunteer with us to take a phone call from someone who called the hotline or the helpline and get them hooked up with therapists. You probably also didn't know that if you want to find someone who's trained at least 14 hours minimum in perinatal mental health, you go to psidirectory.com, go to Tennessee, and you're going to find all the therapists, prescribers, support groups, doulas that have been trained in perinatal mental health. So PTSD, very simply put, someone who had a traumatic birth. All kinds of numbers on this, but latest numbers is up to 45% will report that something traumatic happened to their birth. It's in the eye of the beholder. It's not you saying, well, that wasn't that bad. I've seen way worse. At least you've got a healthy baby. Don't ever start a sentence with at least. It's not a good sentence, okay? It's not ever okay. So they experienced something very traumatic. It's an event occurring during the labor and delivery process that can involve actual or threatened serious injury or death to the mother or her infant. Birth trauma can be both psychological and physical. These are potentially, okay, you all know this, these are potentially traumatic perinatal events. Don't say to someone, wow, that was really a traumatic birth. Right? It may not have been to them, or it may not hit them till 3 months when they start having flashbacks and nightmares. But most people who had a traumatic birth, and we heard about AFE this week, And that is, I'll show you in a slide in a minute, I'm real close with Kaylee Summers that she mentioned, it was in the video that came to comfort her. Kaylee Summers has a Instagram called Birth Trauma Mama. So you can look at Birth Trauma Mama on Instagram. She also has a podcast talking about birth trauma. And so we're going to have her do a special training also that you can take from us on birth trauma. Just because we don't know enough about it or what to do, especially as nurses, right? We're just not, what do we do when we just witnessed it? And you might have your own PTSD, physicians and nurses and whoever was at the delivery, doulas. So these are some hyperemesis gravidarum, that is vomiting 24/7 all through pregnancy, and then suddenly the baby's here and they stop vomiting and everybody goes, oh, she's fine now. Nope, she has PTSD from that pregnancy. And no one believed her. They all called it morning sickness, and she knew it was more than that, okay? Quit telling them to eat saltines. It's not helping. There could be PTSD in the partner, and let's not forget about 1 in 3 women have been sexually abused. 1 in 3. So when they come into delivery and we are touching them, putting our hands inside of them, touching their breasts, we're doing things without asking, and then you add a traumatic birth on top of that, we've got someone with so much trauma. Just assume everyone has trauma that you meet, okay? Assume it. So they have sexual dysfunction after traumatic births. They won't go back to the same OB. They won't go back to the same hospital. They keep reliving it every year on the baby's birthday, and you saw some of that with Annie that was here. I just mentioned this, I was just a slide ahead of myself. Also remember that NICU parents all have PTSD. Just make that assumption. Nobody dreamed their baby would go to NICU and have problems and stay there. They dreamed of taking a healthy baby home. So we have birth trauma support groups. You need to send them to a therapist who is trained in birth trauma because they will have to work through it. EMDR is probably the best therapy approach for birth trauma. ERP is the best therapy for intrusive thoughts. It works through that. We have a Facebook group called Maternal Near Miss. Who is on there? Annie, Kaylee Summers. This is someone who almost died, who could still die, had a heart attack, had a stroke, had AFE, something like that. Huh. Yeah, no, but you cut me short, so can I take extra? Okay, thank you. She's flashing up my minutes up here. Okay, don't forget, bipolar disorder is a chronic, high rates of relapse, and they're going to be at even higher risk of more problems. Someone who has bipolar disorder should stay on meds all through pregnancy and in the first year postpartum, and should be followed by a psychiatric care provider. And we take them off their meds. Sometimes they take themselves off, their mother tells them to go off, but let's not forget, DSM now recognizes there can be a peripartum, in other words, postpartum onset of bipolar disorder, someone diagnosed for the first time. So high rates of recurrence without treatment. Psychosis, 1 to 2 in 1,000. It occurs in 20 to 30% of those with bipolar disorder, so they're at really high risk. What's your risk factors? Family history of bipolar, psychosis, you yourself bipolar or psychosis. So we should be watching them so closely. They're at higher risk of harming themselves or their babies, more themselves than babies. Psychosis is not rare. As one of our lived experience survivors of psychosis said, 1 to 2 in statistic is about psychosis refers to the incidence after live births, but it can also happen after stillbirth, miscarriage, pregnancy termination, and termination for medical reasons, and there's no statistic for that. If we can warn families about a blood clot, that is 1 to 2 in 1,000, we can warn them about psychosis. So, first baby, these are risk factors: discontinue mood stabilizers, antipsychotic, complications, loss, family history, sleep deprivation. This is a great resource for that. Mass General has a psychosis project. I send every one of my clients who experience psychosis to their project. They're doing lots of research. We have coordinators. You want to connect them with our psychosis groups, our coordinators, so they don't feel so alone, because it is fewer with the 1 to 2 in 1,000. So we have a task force, we have an online group, we have videos, How about dads? 1 in 10 dads. We have support groups for dads. We have chat with an expert for dads. No matter where we did research, we find 10% around the world, okay? And what's it look like? It might come out more like 3 to 5 months. I just read a study that was done in Sweden that this huge amount of dads, it hit them at 1 year. So we've got to keep watching. And we know if you're on the Maternal Mortality Review Committee, the maternal mortality happens way further out in postpartum. So the dads, they're aggressive. They go to their man cave. They play video games. They come home later and later from work. We have a 2-day dads training. So if you want to take perinatal or paternal PMH, perinatal mental health, you want to make sure we do it. But the dads are missing their partner. They're left way out of the picture, so there's a lot going on, and we're not asking them. Risk for single moms and dads, even higher for perinatal mood disorder, okay? They're afraid to mention anything because they're afraid you're going to take their baby away. Okay, here it is. Who gets a perinatal mood disorder and why? It's not about hormones. It's not all about hormones, okay? We had the crash, we got the baby blues. But what happens after 2 weeks that causes someone to get one of those things I just talked about? Number 1 risk factor. You previously had a perinatal mood disorder. Your mom had it, your sister had it. You started having symptoms in pregnancy and we didn't treat you. Number 1. This is the number 1, and that is, and we all have it, some more than others, that is any history of any of the things we just talked about. Personal or family history of depression, anxiety, OCD, PTSD, birth trauma, OCD, eating disorders, substance use disorders. You were a moody teenager, you're mean before your periods. Hormonal birth control makes you irritable and mean. You're more hormonally affected. Thyroid imbalance, polycystic ovarian syndrome, decreased fertility, that infertility roller coaster. Do you have a choice about these? This is what I want to show my client. Look at all the risk factors you have. This isn't your fault. I told you yesterday, you're not alone. This affects 1 in 5 to 7 women. You're not to blame. You happen to have a lot of risk factors. I'm so sorry. But this is why you got it. It takes the blame away from them. Oh my gosh. Did they have a choice their baby went to NICU? Risk factor. Did they have a choice that they ended up with an emergent C-section? Risk factor. On and on and on. Postpartum hemorrhage, risk factor. Diabetes, risk factor. Inadequate social support, IV. Personal, financial stress, recent loss or move. Military families, teen parents, parents of multiple, single parents, Black and Indigenous families, and the temperament of baby. Other factors, complications during pregnancy, birth, or breastfeeding. You're a teenager, you're in your 40s. Seasonal affective disorder, we just lived through that. We made it, it's spring. Woo! Perfectionists. Pain, lack of sleep. Pain's going to increase inflammation. Lack of sleep's going to throw the best of us over the edge. Having trouble with breastfeeding or abruptly stopping, which crashes down good hormones. Childcare stress, relationship stress, any previous losses, miscarriage, termination for medical reasons, reduction, elective abortion, history of sexual abuse, culture shock, unresolved grief with your mother. Your mother passed away, your mother's in another country, you and your mother haven't spoken in 5 years, you and your mother do speak, but you argue all the time. Your relationship with your mother is a huge risk factor. And returning to work outside the home after your first, that's a shock. You get to come home and you don't get to prop your feet up and take a break anymore. You start your second shift. And then nobody gets to bed. You don't get a rest until everybody's fed and bathed and in bed, and then you stay up too late watching TikTok, okay? And then you do it all over again tomorrow. So rule out other causes medically that could be going on. This is a great handout. You saw it out there yesterday. It kind of explains all the ways that it can look. Just know that 6 to 8% get gestational hypertension, 6 to 8% get diabetes, 6% get preeclampsia. We watch and check every single pregnant person for those things. But 21% get a perinatal mood disorder, and you're afraid to ask about it because you don't know what to do with them. So, screening. I teach a 4th trimester class. PSI has a 4th trimester class preparing. Make sure you're sending your clients there. you're going to get these handouts. This is also a great way for the new moms to follow someone who does a Mommy and Me group. Screening, I don't have time. Everybody should be screening, and the most common used is the Edinburgh Postnatal Depression Scale and the PHQ-9. And I can tell you all about screening. I started a screening program in 15 hospitals statewide, and people ask me, is this really the best time to screen? Well, probably not, but we've got a captive audience, and we're not just screening. Screening is a piece of paper. What you're doing is educating, okay? So that's my algorithm. You've seen this tool, come out and get it at my exhibit table out there. This discussion tool is what you should be given to them every time you pass a pregnant or postpartum person. It tells risk factors, it tells signs and symptoms, it gives them the helpline, and it gives them how to sign up for support groups. So tools, those are screening tools. I just went through them really fast. How do we get better? We get medically better. We may need meds. We might need a therapist. We definitely need a support group, and we need Mommy and Me, Daddy and Me classes. You're not alone. You're not to blame. Proper treatment, you will be well, and I'm going to be done in 1 minute. Other organizations, resources, we have an app. Please give out resources. We have a helpline. We have a hotline. We have coordinators in every state. We have specialized coordinators. We have international coordinators. We have a chapter in every state. Anybody in here from the Tennessee chapter? Nope. Okay, well, you have one. Get involved with it.